After weeks of reports on the spread of the coronavirus, largely overseas, the CDC warned today that it's not a case of if, but when it starts to spread inside the U.S., with a top official saying, quote, "We are asking the American public to prepare for the expectation that this might be bad." Just yesterday, the World Health Organization said that while the disease is not a pandemic yet, it could be soon, and that sent global markets spiraling, with the past 2 days yielding some of the worst sell-offs in years. Of course, Dr. Donald Trump, whose fate may be tied to the success of the market, was quick to downplay the coronavirus threat all the way from India.
I think it's going to be under control, and I think I can speak for our country. For our country is under control. But again, we do business with a lot of other countries. We take care, we work with other countries. We want other countries to be happy, healthy, and well. They've got to be happy, healthy, and well. It's very simple. And so let's see how it all works out, but I think it's going to work out fine. I hope so.
As for Trump's Health and Human Services Secretary, Alex Azar, he seemed to think the government needs to be doing a bit more than seeing how it all works out.
While the immediate risk to individual members of the American public remains low, there is now community transmission in a number of countries, including outside of Asia, which is deeply concerning. We are working closely with state, local, and private sector partners to prepare for mitigating the virus's potential spread in the United States, as we will likely see more cases here.
The White House belatedly asked Congress to free up $2.5 billion to respond to the global health emergency yesterday, some of which would come from funds set aside to fight Ebola. But some Democrats argued the request was too little and far too late.
The administration has no plan to deal with the coronavirus, no plan, and seemingly no urgency to develop one.
Right now, the administration's approach is disastrously inadequate. The approach right now seems to be take 2 aspirin and call us in the morning. We need to invest more resources.
So with concerns about health and safety growing by the day, how well prepared are we? And how well prepared should you be? I'm joined by Dr. Erica Shenoy. She's Associate Chief of the Infection Control Unit at Mass General Hospital. Doctor, it's great to meet you. Thanks for being here. Boston Globe business columnist Shirley Leung joins us. Good to see you, Shirley. And State Rep Jon Santiago, who's also an emergency room doctor at Boston Medical Center, who serves on the Joint Committee on Public Health at the legislature. Good to see you, Doctor, as well. Let me start with you, Dr. Shenoy, if I can. CDC says this is inevitable. What exactly is inevitable?
So I think what they're talking about is this community spread of the virus. So until now, it's been first in China, then in other countries with person-to-person spread. In the U.S., we really haven't seen person-to-person spread out there in the community.
But it's coming.
I think that's what they're saying.
Does the president have any idea what he's talking about when he says we're doing very well here?
So we have done a lot, I would say, as a society to prepare for this. Hospitals are certainly working to prepare for this. The CDC has released today a report describing all the things that they're doing on the front lines, but we can always be more prepared. And, you know, we can prepare as much as we want, but if a pandemic happens, some of those plans may kind of be not thrown out, but like they have to really be put into gear.
You know, one thing it seems to me, as someone who has no expertise in the area, that there's certain things that we can't do. The WHO was, interestingly, praising China's response, basically saying because it isn't a democracy, they can do whatever the hell they want, and it was praising what they would call the aggressive approach that China took, not just in Wuhan, but beyond.
Right, so what they were able to do is really control in China, or to the best of their ability, control. And in fact, we are trying to do that when we have cases here in the U.S. where we do contact tracing. That's about controlling the spread. But when it's spread broadly, person to person, contact tracing just doesn't work anymore.
Are we doing anything on the state level to be prepared for this, Doctor?
Well, let me just say, I mean, I look at my role, one, as a state representative, but secondly, as an ER physician. Is really
I'm going to ask you about both. So let's start with the state rep part.
I think they're very similar. It really is to protect the public health. And so just this past weekend, I worked 3 nights in a row in the emergency room, and I diagnosed flu a whole host of times. I mean, anywhere from 5 to 10 times a night. And to me, that's what I would be more concerned about than the coronavirus. Now, with respect to my role
the traditional flu,
which
takes in this country 60,000 lives every single year.
Millions of people are infected with, something that we see, something that I would be, frankly, more concerned about than the coronavirus.
How do you know, without getting too technical, how do you know the difference between traditional influenza and coronavirus?
Well, it's tough to know, given that the symptoms are quite similar, and the fact that we can't test for it in the emergency department. So right now, if you were to come to the emergency room, I could swab your nose if I have a high suspicion that you have the flu, and could potentially provide the care that you need to get over it. For right now, to test for coronavirus, that test has to be sent to CDC.
But let's get back to your state rep responsibility. What's the state doing? Are we spending money? Is the infrastructure in place?
Well, I look at the role of every elected official is just to calm the fear that's there, right? I think right now there's a bit of hysteria there. I mean, I would be technically more concerned of the flu than of the coronavirus. So I want to, give credit to the state legislators, as well as, anywhere from Mary Lou Sutters, who's the Secretary of Human Health, to Monica Burrell, the Department of Public Health, who's been out there really engaging the community on this issue.
But, Doctor, when you say hysteria be a problem, and I couldn't agree more, isn't it an equal problem, the President of the United States saying, don't worry, everything's under control? The basic message to the American people is don't worry, be happy. At least that's the message I'm taking away.
Well, I wouldn't trust much of what Trump says with regard to any issue, but what I would say is that my message would be prevention, prevention, prevention.
Can we talk about another aspect? Obviously, the health implications are immense, but the economic, business implications are immense. You wrote this line today in the Globe, Shirley. Increasingly made in China isn't what it used to be. What does that mean?
It means that, a lot of companies, including many in Massachusetts, had moved their manufacturing to China over decades. And now what they're realizing is that they're too dependent on China for their supply chain. So when you look at how coronavirus has disrupted the supply chain, with the travel ban, people, can't go to work. The whole chain has been really, screwed up. And so now what we're finding is that a lot of companies are thinking we need to move manufacturing out of China. We need to diversify the supply chain.
It's amazing. I'm reading your piece today, and it seems that as horrible as it is, that the virus may have achieved what Trump's tariffs couldn't achieve. I'm serious. It
did. It was, some companies started to think about this with the tariffs, but now the coronavirus is really a game changer, as one professor told me, that this will really force a lot of companies to rethink their strategy in China.
Can we get back to the mixed message thing here, at least speaking to you two, at least that I'm taking away from this? Here is another doctor, Rush Limbaugh, on his show talking about coronavirus. Here's Limbaugh.
It looks like the coronavirus being weaponized as yet another element to bring down Donald Trump. Now, I want to tell you the truth about the coronavirus. The coronavirus is the common cold, folks. The drive-by media hype of this thing as a pandemic, as the Andromeda strain, as, oh my God, if you get it, you're dead. The survival rate is 98%. It probably is a Chi-Com laboratory experiment that is in the process of being weaponized.
You seem quite calm about this, but I have to say the most powerful radio voice, media voice, maybe in America, the most powerful voice in the world are, again, basically in sync, saying no problem, nothing to see here, move on. Doesn't that make your job a hell of a lot more difficult?
I would say that it's not that it's not a problem, but I would echo what was said about the flu. The flu right now, for the individual person on the street right now, the flu is much more of the risk to an individual. We at the hospital level, at I would say schools, other places like the CDC is saying have to prepare for a time in which we will have many more people infected. Now, some of them, like has been stated in what is being published, will survive and do very well. We may have, perhaps 80–90% of people with mild disease to moderate disease. There will be a segment that will require hospitalization. Some will be in an ICU. What differs from the flu, and I think what makes us worried, is that we don't know everything about this virus. We know a lot about the flu, and we don't have treatments or a vaccine.
Well, except, once again, I'm sorry, I'm not the expert.
Yeah.
But if I turn on television today, I also hear the President of the United States, don't worry, vaccine's right around the corner. The vaccine is not right around the corner, from what I read at least. Am I right about that?
I think you're right. I don't think it's around the corner.
How prepared are emergency rooms? How prepared are hospitals? How prepared or is the medical infrastructure?
Well,
in
for
our
one,
community?
I would stop taking medical advice from Donald Trump. I mean, nor do I take political advice from him. Similarly, I would not take medical advice. What I would say is I would speak to your doctors. I mean, here you are, you have an infectious disease doctor from MGH who comes from an institution in a state that's heavily resourced and prepared to take on if an epidemic were to happen in the state of Massachusetts.
So when we just heard a minute ago that the CDC person saying we're asking the American public to prepare that this may be bad, whether it's the traditional flu or coronavirus, what is a member of the American public, how are we to be prepared? What do we do?
Well, as I would say, I'd be on the lookout for any kind of symptoms that would be concerning for coronavirus. I mean, if you're sneezing, cough, fever, if you have a real fever, if you measure your fever, then you should be on the lookout. I mean, again, the vast majority of these cases are just a common cold or the flu. And you will have symptoms that are similar to coronavirus, but I wouldn't jump to have the coronavirus and let's do something drastic about it at this time.
While the virus has been very slow in coming, racism has proceeded at a much faster rate practically all over the country, Shirley Leung, yes?
Yes. I mean, almost immediately, in Asian communities here, like in Quincy and Chinatown, people are not going to, Chinese restaurants. They're concerned about the virus. They're, I think when you talk to Michelle Wu on the city council, she herself has, heard and felt racism, and people
a lot of kids.
Really scared.
I've read stories of Asian American kids
exactly.
getting baited and bullied
exactly.
over this kind of thing.
Exactly. So, now it's been like at least a month in the U.S. I think there's been a lot of media attention to this, so I think it's good, and people know not to take it out on people who are Asian American.
Can we talk about the businesses that Shirley talked about a minute ago, starting with you? Chinese restaurants is not just here, but around this country, mostly small businesses, not large ones, losing 40, 50, 70% of their business. Should a person be scared to go into a Chinese restaurant on
the short
February
answer is
25th?
absolutely not. And I think some of the elected officials have done that, have gone out to these communities, whether it's in Boston or whether it's in Quincy.
The mayor did just the other day here.
That it's okay. And I think we, as elected officials and as people of the physician community, should be really endorsing that and supporting those efforts.
Last thing with you, Dr. Shenoy, if I can. What is the moment, assuming that we're going to go beyond whatever we have now, 57 cases or whatever, 5, 6 dozen, that sort of thing. What is the moment that people like you are looking for?
So I'm looking for sustained community transmission. Even though we've had 53 cases in the United States, more than half of them, or at least as of 2 hours ago when I looked, those ones have been really related either to a travel exposure to Wuhan, China, or a close contact, or the Diamond Princess. So we don't have what we have with flu, which is sustained transmission just out there in the community. So when that starts happening, or we see clusters of cases that are acquired here in the U.S., that's when I'll start thinking that we have to shift.
One last thing for you. I'm so glad you brought up the traditional flu. I'd never understood. We were talking to a medical ethicist, a regular on a radio show the other day, and he said something very similar to what you said. And I say to myself, so much attention is being dedicated to the coronavirus. I'm not saying we shouldn't. But about this smaller percentage is being dedicated to something we talked about a minute ago, 10 to 60,000 deaths. So might this provide a window for people like you to be able to talk to people about the danger of the traditional virus itself?
I mean, absolutely. I think, with respect to what we're doing in the emergency department right now, I mean, I'm sure whether it's your emergency department or my own, I mean, we are heavily screening people for this, for travel. And so, again, my message would be prevention, prevention, prevention.
Good enough, John. Good to see you, Doctor. Pleasure. Pardon me. Shirley, good to see you. Doctor, great to meet you. Thanks so much for your time.